Welcome. The cardiology aspect of the critical care nursing exams is very interesting, intimidating. 3 questions, rapid review. That is normal 6. High yield fact to show you how to master them. Stick around. I will make these exams very easy when it comes to the cardiac aspect of it. Let's take a look at it. This is the question. How do you answer question? Read it from the back and find out what is the buzzword. Which of the following intervention, the nurse is doing something, is not appropriate. Wrong answer for assessing for limb ischemia. What is it associated with? The nurse is what? Monitoring a client following insertion of intra-aortic balloon pump. What is the problem? Think about it. Intra-aortic balloon pump is used for what? Shock, cardiogenic shock. And we're trying to maintain systemic blood flow. What action by the nurse is going to cause problem and lead to ischemia? Remember, we have a catheter in the artery. There will be emboli that go into the lower extremities that can cause ischemia. What action should the nurse take to prevent ischemia? Frequently flushing the pump, the catheter, what do you think? Is going to flush things down. Checking peripheral pulses every hour, that is good. Assessing skin color and temperature hourly. You're still doing neurovascular check. Measuring ankle brachial index every hour. Best way to assess what? Blood flow to the lower extremities. Which action is wrong? Vigilant hourly check of a neurovascular status is the best way. Which one is not saying that? When you're just flushing it, you're just pumping a clot into the lower extremities, and what is going to happen? More ischemia. Therefore, number 1 is a bad idea. The nurse should not do that. Number 2, which of the following is not the potential negative effect of what? Shivering during TTM. What is that? Targeted temperature therapy. It's a selected apply. The client is undergoing therapeutic temperature management following a cardiac arrest. The nurse notes the client has begun to shiver. Bring your content. What is what? Targeted temperature therapy for patient who has cardiac arrest. We want to decrease oxygen demand, brain function at this time so they can recover in the future. Less metabolic effect on the brain. Everything cool down to a temperature that we have set. Which of this is not the negative pressure? You shivering, think about it. Does shivering increase oxygen demand? Does shivering decrease SVO2? Does shivering increases intracranial pressure? Does shivering lead to respiratory alkalosis? Does shivering interrupt cooling protocol? You see the way I'm using shivering. That is what you will focus on, right? Those are the buzzwords. This is the key. When you shiver or you have shivering, you're going to increase oxygen demand. Your whole body is in the hyperdynamic state. Oxygen demand is going to increase. In the process, you're going to increase oxygen consumption. Therefore, 1 is right. If I increase oxygen consumption, my venous system is going to go down. So SVO2 goes down. Those are all what you expect. Your brain also is going to increase its activity. In the process, you have increasing intracranial pressure. So that is what is going to happen. But what is going to happen? You have hypoxic state. In the process, you lead to respiratory what? Acidosis, not alkalosis. You're also going to interrupt your cooling protocol. Why? Because you generate your own heat when you're shivering, and this will affect the therapeutic index that we're trying to assess regarding your brain function and the therapeutic targeted temperature. The time it takes to attain that targeted temperature will increase. It will take a long time. It will affect the flow and interrupt the cooling protocol. So the only thing that is not the potential negative effect is what? Respiratory alkalosis. It leads to what? Respiratory acidosis. So there's only one answer. Last one. Which of the following hemodynamic findings should the nurse anticipate? The client undergoes an echocardiogram revealing what? Severe right ventricular dilation. Right. And a significant tricuspid regurgitation. Right. Think about it. Both sides are on the right. The left ventricular function is preserved. Your left side is good. The client has a pulmonary artery catheter in place. Which of the following hemodynamic findings should the nurse expect? Decreased right atrial pressure, decreased pulmonary artery systolic pressure, decreased pulmonary capillary wedge pressure, or elevated CVP. This is a bunch of words that if you take your time, go for the bars with, and draw your heart and divide it into two. We have right atrium here, right ventricle, left atrium, left ventricle. We're dealing with the tricuspid. Everything is on the right. Right side is dilated. Tricuspid is also affected. We have a bunch of regurgitation. That means everything is built up. The right side is screwed up, and therefore blood back up into the systemic. Nothing is going to happen to the left or your lung because what? The left ventricular function is preserved. Therefore, I see pulmonary artery systolic pressure is going to be normal. The wedge is also going to be normal. I eliminate it. I see decreased right atrial pressure. Well, your right ventricle is affected. The pressure is going to increase. Test taking strategy, CVP, systemic central venous pressure is going to increase. 3 questions, I yield, content-based, rapid review. Take care of yourself and follow the series. This is not my sis. Take care of yourself and good luck.